News for your health now. Mental health conditions can be tough to diagnose, and patients often go years without knowing what's wrong and missing out on treatment that could help. But now there's a new test that can help identify a person's illness earlier. It only takes a few minutes, and doctors say it can make a big difference.
I had 15 hospitalizations, I had electroshock therapy. I've been on, I can't even tell you how many medications over the years.
It took 5 long years before Patrick Henry was finally diagnosed with bipolar disorder. And it was during those years that his business crumbled, his marriage suffered, and his relationships with friends fell apart.
And that's why anything that we can use to find early warning signs or figure out what's going on with a person as soon as possible really changes the outcome of the illness.
Now doctors have a new tool to help them diagnose mental illness. It's called the M3 screen. It's a 30-question online test that looks for key signs of conditions like depression, post-traumatic stress disorder, anxiety, and bipolar disorder.
We need a test to make it easier for patients to get diagnosed in medical practices and primary care practices.
After someone takes the test, the website immediately provides a score from 0 to just over 100. If the number's over 30, a person may have a mental health issue. The higher the number, the more severe that condition might be. Dr. Robert Post is a psychiatrist who studied mood disorders at the National Institutes of Mental Health for decades. He helped develop the M3 screen.
And we think it's critical that patients have numbers, just like everybody knows their blood pressure and their cholesterol.
I took the test, and it really is as fast and easy as the developers claim. You don't have to enter any of your personal information online either. You answer the questions, and right away you get your results and your recommendations.
In primary care, we're really trying to take care of the whole person, and that shouldn't just be a list of health issues.
Bethesda internist Dr. Alan Sheff has been using the M3 screen with his patients during their annual checkups. He says it's helped him identify some patients who he thought were depressed, but who were really suffering from PTSD or bipolar disorder. He says the online screening helps him get important information about his patients much more quickly than simply asking them in person.
Primary care physicians are busy. There's a lot that goes on in our visits with our patients.
Patrick Henry now has his bipolar disorder under control, and now he uses the M3 test on an ongoing basis to monitor his condition.
If I had been diagnosed then and got the help I needed, I think I would have been able to continue working. I wouldn't have ended up destroying my business. I destroyed my marriage. I had a real heavy price to pay, as do most people diagnosed with a major mental illness, unless we catch it very early.
Patrick Henry has found a new career as a mental health advocate, and he's doing really well. The M3 test is not meant to be a diagnosis alone. It can identify a potential problem and then help you start a discussion with your doctor. You can check it out yourself online. We've set up a link to the test on our website, NBCWashington.com. Search for mental health test.